Hello and welcome to the self-learning module on atrial fibrillation. This is meant for patients and families. My name is Mukesh Bhargava and I will be guiding you through this tutorial on atrial fibrillation, which is also commonly known as AFib. Let us begin by watching a short movie together.
A healthy heart works continuously to pump blood around the body by beating regularly under the control of electrical impulses that originate from the sinoatrial or SA node, the heart's natural pacemaker. These impulses radiate from the top to the bottom of the heart in a coordinated way. Each heartbeat consists of two stages where blood enters the atria, which subsequently contract, and forces blood into the ventricles. These in turn also contract, forcing blood out of the heart into the pulmonary and systemic circulations. In atrial fibrillation, electrical impulses do not originate in the sinoatrial or SA node, but from a different part of the atrium or in the nearby pulmonary veins. These abnormal electrical signals become rapid and disorganized, radiating through the atrial walls in an uncoordinated manner. This can cause the walls of the atria to fibrillate or quiver rapidly rather than contracting normally. Electrical signals are transmitted irregularly from the atria to the ventricles, which both fail to contract in a synchronized way. During atrial fibrillation, because the atria do not contract regularly, blood does not empty efficiently into the ventricles and begins to pool in the atria, especially in the atrial appendages. This pooling of blood can cause clots to form, which, if dislodged, can travel in the bloodstream towards the brain. The clot, or embolus, can potentially obstruct narrow blood vessels, often the middle cerebral artery or its branches, and prevent the normal flow of blood. The reduced supply of blood and oxygen to a particular part of the brain can result in tissue death, leading to ischemic stroke.
So what are the symptoms of atrial fibrillation? Symptoms can vary widely. You may experience pounding in your chest. Some people feel that there are butterflies in their chest fluttering around. Some other folks feel that their heart is beating fast and irregular. Others feel that their heart is starting and stopping. Other non-heart related symptoms may be shortness of breath, overall fatigue, lightheadedness. Sometimes atrial fibrillation just gets detected at a regular checkup. People also are alerted by their smart devices like smartwatches or other wearables that may monitor your heart rate. Commonly, we also see patients whose blood pressure instrument indicates that they may have an irregular heartbeat. All of these are reasons to seek medical attention. Let us talk next about what is the goal for treatment. The goals of treatment in atrial fibrillation revolve around several key objectives. They are aimed at improving the quality of life, reducing symptoms, and minimizing the risk of complications associated with atrial fibrillation. The first thing we try to do is control the heart rate. This is one of the primary goals, and our aim is to usually control the heart rate between 60 to 100 beats per minute at rest. This should alleviate any symptoms such as palpitations, shortness of breath, and fatigue, which is related just because you have a fast heart rate. We also look at trying to control the rhythm. This is often done by medications, or by electrical shock called cardioversion. This is decided on a person-by-person basis, and not everybody maintains a regular rhythm. It can also be reverted to a regular rhythm by ablation, which is an invasive procedure and is done in some patients, not all. The third thing that is quite important is prevention of complications, namely stroke. As you saw in the video, that atrial fibrillation predisposes the person to have clots in the top chambers of their heart. If we were to thin the blood, there is a good chance that a clot will not form. This is done usually by using some form of blood thinners. The type of blood thinner is individualized based on individual patient conditions and risk factors. Lastly, we also screen for other medical conditions that may cause or make atrial fibrillation worse. This includes high blood pressure, heart failure, thyroid problems, and sleep apnea. Implementing lifestyle modification such as smoking cessation, weight management, and regular medical checkups is quite important in the management of atrial fibrillation. As we conclude this video, I would like to share with you symptoms of concern. These include, but are not limited to, chest discomfort, new shortness of breath, lightheadedness or dizziness, new swollen ankles, inability for you to lay flat because you get short of breath, symptoms of stroke. These include lack of movement on one side of the body, facial asymmetry, your face appears crooked, you cannot see out of one eye suddenly, as if a curtain fell on that eye, or you have difficulty speaking or your speech is garbled. Symptoms of stroke should be taken very seriously, and you should call 911 and go to the closest emergency room. Thank you for making the effort to learn. We hope this video has been informative and helpful to you.